supposedly our last meeting. Supposedly our last meeting, unless we need to get together on December 8th or thereafter. What I hope comes out of today is we've learned tons of ideas on how to help our adult centers, and that we can go over those and kind of get bullets of things that we would like to see. Because there were many ways. And then from there, I can work with Brittany and others to see what would those that need policy, what would those look like, and bring the group back together to see the end result of all our work these past couple of months. Does anyone have comments on that? No, we're good. We did have a guest speaker, unfortunately, Krista, and it was my fault not getting to her sooner, but she has another appointment today. And but she said, please feel free. She was happy to know that we valued her presentation, and that if anyone wants or has questions, can reach out to her directly. So we have that. So let's get right into it. Let's just bullet what were some of the ideas that we felt were important to help adult centers to be successful.
I'd love to start. Being an adult day center. Good morning, everyone. This has been a fantastic opportunity for us and for me personally to grow in this field. And I thank all of you before I even start for being here. I think for us, we too have learned so much. And we realize that dollars and cents are very important. And we need to figure out ways to grow this industry many faceted. I think what was clear is that the under 65 population, there are so few slots in the state and the programs that currently exist in the waiver. We know there's 101 and 25 in another. And we feel that's a really important starting place because it's a very underserved population that hopefully if we can help to transform their lifestyle at that point when they are still young and need the support so that maybe family can work, keeping those people out of long-term care facilities, saving the state money, keeping the person in the community would be a tremendous use of some assets or direction for us to focus. That is for us a very important take from this meeting. Also, the transportation piece is a huge piece for us to delve into further, to see how we can try to accomplish subsidizing that part of our program that is kind of eating at budgets tremendously in an economic time where we're dealing with so many other things. Those really important also is messaging better about Adult Day and letting professionals all over the state realize that we're not daycare. We don't want people to think of us as daycare. We want people to think of us as engaging, meaningful community opportunities for seniors that helps keep them healthy and at home. And so maybe it's important for us to get that message out there better, especially to the access agencies and the DSS workers, which hopefully Chrissy will get on, or Cameron may have been sent a link to something that the association has just developed that is going to help new people working in those organizations and seasoned people remember succinctly what it is we're really all about and get that out to people. I've always been a proponent that sometimes you have to spend money to make money, or in this case, save money. If the long-term effect of people having to be in long-term care facilities, higher price tags, if we're maybe putting a few more people earlier on into adult day programs, notice I didn't use daycare centers, adult day programs, we can save the state money. I'm all about saving money. I think that is really so important. But for me, really, this is about the choice of a person to remain in their community, be active in their community, and home with their family for as long as absolutely possible. I think I've almost covered everything that we're really thinking about. We understand and have begun to learn about the PACE option and how that might in the future be able to, because I don't think it's something that's going to come in the next budget year or some, we understand it will take a few years, how that can also help our industry to attract more people in our programs. And we're all for looking into that and being involved in that process as well. I believe I've covered our take on this. And we, again, thank all of you for partnering with us through this process of taking a look at adult day and how to adult day programs and services and home care adult day programs and services and putting them on the map for Connecticut residents.
Thank you, Cheryl. That was a good list. Jennifer.
Oh, I'm just, certainly reiterating what, Cheryl's message. I think the piece that the Adult Day Health Association put together, really, I think, having worked in this industry for a long time and starting out as a geriatric care manager with an access agency, I won't say how many years ago, but I think there's a huge misconception. So I think that is a big piece for folks to understand, right, that this is not a daycare center, and really how important the social interaction with the peer group is, and good nutrition and oversight, in the medical models, oversight of having, nursing care, as well as, right, being good fiscal stewards, so that we can hopefully serve as many people as possible by having, a great cost-effective option without impacting the quality of care or service that individuals are getting, and certainly understand, obviously, the transportation issue and needing to sort of come up to some sort of alternative model to that.
Thank you. Anne.
Thank you for distilling some of the work that we've really tried to do. I do think highlighting transportation as a tangible way the state can begin to address the cost to the centers and to the individuals and their families themselves is an important takeaway. Maybe could a proposal to come out of this to like embed that in our state budget, almost a line item. But I wanted to highlight a couple things that Cheryl and others say is that what we're now pivoting to is an important, it's like an important fusion service that has been invisible before now. What has been invisible is unpaid family caretakers at home, or people living alone, or spouses and so forth. And now we are pivoting to a professional model of programming and engagement and health and medical and non-medical model. And we need to invest in it. And we're never going back to the unpaid family caregiver, mostly female model of just, multi-generations just taking care of their seniors in this country. Never going back to that. So the sooner we embrace and fund and invest in a variety of choice models, right? This isn't the only one, but to put it all on the burden of these mostly nonprofit adult day centers to figure it out all on their own is ridiculous, because we have just had family women caregivers largely bearing the cost of this critical service, keeping families out of the nursing homes longer and all that kind of stuff. And now it's time for the communities to collectively invest in this. So I hope the takeaway is that we'll phase it in and include all the things that we're talking about, which includes messaging and really making much more visible the value of these services, and get that census up and serve a wider range of ages and needs. But in the meantime, I'm really clear that the state needs to invest in this, and transportation and mobility as a right and as a service is just an easy way to take that piece of it and fund it. You know what I mean? So to figure out policy wise how we can suggest that going forward as a permanent thing is a first step.
Thank you, Anne. Chrissy.
Hi, yes, thank you so much. And thank you so much, Representative Garibay and Hughes, and everybody for the support and encouraging words. Once again, I apologize for my technical difficulties, as I've had to relocate myself outdoors to even be able to hear now. So I apologize. But I just wanted to build on two things. One is, as Cheryl was speaking about, the expansion for enrollment of clients under the age of 65, particularly the pathways that exist now, including the, just to specify them, including the Connecticut Home Care Program for Disabled, and also including the program that Ms. Dorian Long had spoke about, particularly those programs. And if there is any alternative pathway to be defined through existing channels or through a new channel, to allow folks outside of the home care program waiver to attend or to be enrolled through other channels. These are Medicaid qualified individuals. And secondly, just that was just one clarification. And then secondly, just wanted to point out, as I'm sure we'll have to take a look at the financial impact of all of this expansion that we hope to have, that it, just as a reminder to, I'm sure everybody's aware, but just to keep in consideration, that we're looking to provide services to folks that are medically qualified for our programs, and are likely receiving other services already, be it home care, be it long-term care placement, and just to offer them a choice of what is seemingly a more affordable option for the state. So just as we're calculating all of the cost, to be sure to keep in mind that there is some offset, that we would be providing some savings in the long-term scope, due to the fact that people now have a choice of only more expensive services. Sorry, and again, apologize for my technical difficulties.
No, thank you, Chrissy. Is there anyone else? So what we've heard today is under 65 who are underserved, transportation, messaging, not a daycare, it's a community opportunity for seniors, PACE, and then the outside waiver for the under 65. Is there anything else that we thought was really important?
I'm sorry, also Representative Garibay, just as a note, I did share the training video with Mr. Cameron, and glad to send it to anybody else who likes it or would like to have it, if we could share that as a resource. Thank you.
You can send that out.
I just posted in the chat for anyone who wants to take a look at it, and I can include it with the minutes later if you would like.
That would be great, Cameron. Thank you. So in our wish list would be able to snap our fingers and all of these could be instituted in 2023. I know, Anne, that's what we would love. So we're going to take a look at are people willing to come back to the table when we come up with a semi-plan to look at, to tweak, what do we think legislatively we can do this year? Sometimes it takes a couple of sessions to get something through. What do you all think?
I know our association would be glad to continue.
And I'm just talking about one more meeting. I know we have December 8th. I don't know if we can have things ready by then. What do you think, Margaret?
Sure, I'd be happy to continue. Thank you.
Okay, thank you. Anybody else? Well, it's been great work. I think we all have a consensus that these are all things that we think are very important. And now it's to for us to reach out a little bit and see how are we going to do this? How are we going to get it done? And I like the fact that when we're talking about, okay, we're going to provide transportation, whatever that plan is. But by people being able to go to adult centers, we're saving tons of money on other services they might be receiving, or nursing home helps keep them at home. So that's the hard part. How do we calculate the savings against the expenditure? But it will be there in some form. Right? Do you have any thoughts on Zanny? And I know I butchered your name again, but
It's okay. The one thing, and if we can just, I know we've probably gone over it, but the transportation side, if we can like delve into that just a little bit, and like maybe even define it a little bit for OPM side, just so I can understand it, because I'm new to the Health and Human Services too, so it helps me to understand when we say transportation, what is if you were to boil it down to two sentences, what is the transportation issue, and help me understand it as a newer member of even working on this.
Would you like me to answer that?
sure.
Okay, so adult day centers are required to provide or arrange for transportation to and from our day programs. And at this time, the cost of the transportation is included in the daily rate. But we have calculated the costs associated with providing the transportation, and it is a huge part of the budget, even more so now than it was a few years ago. So we'd be interested at looking at a separate rate for transportation to provide to and from our adult day centers. And in most states, or in several states, it is a separate service item that is billed for outside of the daily cost.
Chrissy, can you share what is the rate you receive now?
We get $86.11 per day, and that is inclusive of the full day of adult day service, including meals, a nurse on site, social services, activities, all of the overhead costs, and as well as the cost of operating vans or contracting vans to bring people back and forth.
Right. What is the average rate for transportation per day?
We calculated that to be somewhere, depending on the region of the state, because there's, city regions and then very spread out more rural regions. We calculated that to be anywhere between, I believe, $13 and $17 each way.
Each way.
Per person.
So we're talking about $30 out of that $86 it's spent on transportation.
At least.
At least.
And actually, the centers that we use to calculate that, the centers that volunteer their information, were centers that have their own vans and drivers, where I know that centers who contract out the transportation pay a higher rate.
Yeah, and Zani, most of them are some sort of blend. They have also not just exclusively, especially in the cities, not exclusively their own van or bus, but also use the transit district disabled, curb, door. I don't know if it's door to door or curbside, but one of the two. Anyways, as we're looking at, in this time of economic downturn as a state, we're looking at extending fare-free buses, but we haven't really done anything with these adult day transportation costs that are continuing to disproportionately burden these programs, which, like, Cheryl and Jane are saying, are saving the state money in the long run. So how can we leverage that savings and maybe do that analysis is what I'm hearing you say, Jane, is we've got to do that analysis a little bit upfront, especially for OPM, to understand that I just see it as a real tangible way to invest in serving more people, in being successful again, in pivoting from what we have basically been just relying on our entire care system of unpaid homebound caregivers. And that's not tenable anymore. It never was, but it's certainly not anymore.
Mhm. I agree. We have to prove our case, in some way, so it doesn't just get, thrown out. So, Melissa.
Yeah, I just want to delve into the transportation issue a little bit deeper. So, a question for Chrissy, Cheryl. The two quick things. So you already talked about people using the paratransit, et cetera. Do any of the adult day centers use any of the ITN networks that exist, like in North Central Connecticut, or any of the free transportation services that aren't related to paratransit or Dial-A-Ride?
I would have to check that with people in different parts of the state, but I know that some of the services do not qualify for adult day centers. Like there is some service that will take folks to doctor's appointments and things like that, but they do not include going to an adult day center.
Oh, okay. That's really interesting. And then also the ones that contract out, do you know the reasoning behind that versus having their own vans? Is it simply that they can't afford a driver, they can't afford to purchase the van, the upkeep of the van?
Could be any or all of those reasons.
All of that. Okay.
All of that. Yep. It depends on the size of the program, the location of the program. Sometimes employing a van, employing a driver, and the cost of the van and upkeep outweighs the number of people that will use the van, because you do have some places where they'll have private pay folks or folks whose family might deliver them to the program and pick them up. And also because the staffing issues, the drivers have to be licensed with a public safety license in order to be qualified to drive the vans. And those salaries can run upwards of, about $20 per hour, sometimes more. It's very competitive to find drivers in this environment where we are now.
And then my last question, and I thank you so much for bearing with me. You mentioned that other states have a separate rate, transportation rate, and that it's not part of the bundled daily rate. Do you happen to know off the top of your head which, a couple of the states at least that provide that, or where we could get more information on on those states?
Sure, I'd be glad to gather some information. I know particularly Massachusetts does, just because that's where I've operated for more than 10 years. They do customized transportation rate based on your location, because it does vary. So it's not across the board, but those rates vary from $15 and up. It's a lot of states. I can actually get the information from the National Association and send it out to everybody. I can get some examples, but most states do have a separate rate for transportation.
That would be extremely helpful to not only see the other states' rates, although we can't compare Connecticut, directly to other states. It's a helpful guiding post, but it's also helpful to show if Connecticut's an outlier and how we are doing our reimbursement rates versus other states. So that'd be great.
Absolutely.
Thanks,
We'd be
Chris.
glad to send that information. We've also found that Connecticut is kind of an outlier in the enrollment as well. So that's what led us to kind of pick up these causes. So we really appreciate you considering that.
Thanks.
And there are organizations up in where Windsor, we have Nutmeg Ride. I don't know if anyone's heard of it. And it's like $7 each way, but they use a ton of volunteers that are screened, but they're volunteers in their own vehicles. So it might not meet the criteria of being certified, et cetera. But that's a lot of people use it, and it's a good program. Any further comments? Yeah, that was a good answer to the transportation. That gives us more of a guide of where to go, and basing it on where other people are does help. Any other comments? No? No? Oh, Margaret?
Yes, thank you. I just wanted to emphasize the importance of the messaging and then the outreach and education piece, and we can certainly try to be helpful with that. But for the new in the season folks and, also for the families. So finding ways to do that piece of it, getting the messaging together, then getting it out there. We're happy to help with that too. Thank you.
Thank you. Yeah, I think each piece that we've talked about today, which I have 5 on my list, are all crucial, and it's a little bit of everything, and not just one thing. So we're finished real early today. I thank everybody for coming and the weeks that you've devoted to this. We will get back with you how we're going to move forward and for more ideas and what we can do. And please feel free to send Ann and I any ideas, and Cameron, any ideas that you have that can help us in any of these areas. That would be great. Okay, well, enjoy your cold, maybe snowy day. I don't know. I like snow, so I don't like the cold. I'd be happy with snow in summer, right?
Thank you.
very much.
Thank you. Happy Thanksgiving, everyone.
Yeah.